My name is Chris Surek. I'm Chief Resident of Plastic Surgery at the University of Kansas Medical Center. In between your preclinical and clinical years at KCU, you have the opportunity to apply for a clinical anatomy fellowship, which actually now also has a master's track in anatomy, which is really awesome. I think the anatomy fellowship was a game changer for me. It really helped me elevate my resume, my dissection skills, and really my opportunity to network. I think the benefits of the anatomy fellowship are tremendous. Number one, it gives you a chance to dissect for a full year and work on your hand and dexterity skills. That's really important for being a surgeon. And although you do some of those dissections in your first and second year, this gives you a chance to really take apart the anatomy piece by piece and get a strong command. The labs there are state of the art. I mean, if you are interested in anatomy and you want to become a better surgeon by becoming a better dissector, because really it's all about having good hands and having a good command understanding of the anatomy so that you can make confident cuts and dissect appropriately and avoid any unwanted complications. And that anatomy lab and that training facility really helps you accomplish that. So for me, it was critical, and I think it's made me a much better surgeon. Number two, you get a chance to teach. And there's no better way to master any subject than to teach it. And you get a full year, again, focused on anatomical sciences, picking an anatomical region of your interest. Then it becomes inherent and intuitive, so that when you get out in your clinical rotations and you're getting asked questions by your attendings, or you're faced with that one chance where you finally get to dissect, then you get to use all that intuitive training and you put it to work, and it becomes second nature to you. And I think that's a really big advantage. And then the third advantage is the research. So you're going to dissect, you're going to teach, and you're going to research. And by and large, everything we do in surgery is based on a manuscript or a publication or a chapter that was published by someone at some point in time. And this gives you a chance to be one of those people. And having that skill set makes you attractive in residency applications, because the fact that you're able to do research, conduct it, and complete it is very attractive in the resident application process. And I found that out once I got on the other side and we were looking at applicants to my own residency program. This gave me a chance to really work on not only my skill set, but my research, my command of knowledge base, and also to network. And all of that strategic planning was critical for me. And honestly, if I didn't do the fellowship, I don't think I would have gotten the residency that I wanted, bottom line. To me, I think the fellowship is a lot more than the compensation package attached to it. I think what it is it gives you a true opportunity, kind of a golden opportunity to maximize your potential. If you have a dream and you have a goal and you want to maximize the chance to obtain that, and oftentimes, in medical school, once we figure out what we want to do, then the whole goal is how do I get into residency? Because that's what it's all about. I mean, your match into residency determines what you're going to do for the next 30, 40 years of your life. And so although KCU prepares you really well in their standard curriculum, I think sometimes you want to get that spot that you really want to get in residency, or you want to really maximize your potential and harness the stuff that you've learned and use it to your advantage. I think that the fellowship gives you a chance to do that. And I would encourage any student who has a passion for surgery in particular to consider the anatomy fellowship. I think it would elevate them on a lot of levels.